So you call it functional sinus surgery.
Yeah.
What is it?
Well,
And who's a candidate?
yeah, well, it's the people that have is chronic sinusitis, and they come in with discolored nasal drainage and postnasal drainage and facial pain and pressure, maybe pain down into their teeth or associated headaches, can't breathe, they're miserable from the pain frequently. And so it's functional in that we try to focus in on the functions of the nose and sinuses when we're doing it. And we've defined scientifically, not me, but the people that do the basic science research have defined exactly where those focal points are, where the sinuses open into the nose. And we know that the nose and the sinuses help us filter and warm and humidify the air we breathe. So the functions of the nose to warm and humidify and filter the air that we breathe, that's why we have the sinuses, because we need that surface area for the sinuses to work. Well, when the sinuses get blocked, then the people traditionally will take either over-the-counter medications, or sometimes it requires antibiotic therapy. But if that persists over a long period of time, weeks or months even sometimes, then it requires surgical intervention if they've failed very appropriate medical therapy. So in those folks, it's outpatient surgery. Okay. It's under general anesthesia, so they don't feel anything. We'll go in and focus in on the small funnel points from the sinuses, which are here and between the eyes and behind the eyes and the cheeks, and open those up, clean them, and then restore the normal functions in the nose to where they can take and breathe and get the air they need.
And how soon does that happen? Where their symptoms are going away?
Yeah, they're usually a lot better at like 5 to 7 days. They feel like they have a really bad cold for about 5 to 7 days. They'll take and have a lot of congestion. It doesn't change the way they look or make them black and blue, or they don't have facial swelling. And then I'll see them back at that point, and then several times afterwards. And that's when they really start to feel better.
What about safety? Safe procedure?
In this day and age, there's a lot of technology that makes it safe, and the risk of major complications from sinus surgery is very, very low. If you read on the internet in a textbook, they're say, what are the risks? Well, the risk of anesthesia. Obviously, most people are not at increased risk, and that risk is probably a lot less than you driving on the highway at 5 o'clock. Okay. Risk of bleeding. I've never had to transfuse anybody during the operation. Occasionally, people have nosebleeds. It's not very often. In fact, we don't even pack most people's noses now at all. And other risks will say, well, risk of injury to adjacent structures. So what's there? Well, the sinuses they're between the eyes and up here above the eyes, and they're below where the bone that separates the nose and the brain. Knock on wood, but with the current techniques, I've done thousands of sinus operations. Not had any of that happen.
Okay, good.
And I don't want to have my first one. So we do some things that are neat, and we've got some good technology. Actually, it's called stealth technology, where we use image guidance. So we'll take a CT scan, which is special.
So all of
X-ray.
these are image guidance?
All of them.
Okay.
All of them that are done under general anesthesia, the functional endoscopic sinus surgery, are done with image guidance. So they take a CT scan that helps us with diagnosis. Special X-ray looks at the sinuses, and we'll plug that into computer navigation systems, and it actually maps our instruments to their CT. So not only can I see what's going on a video screen with the tiny cameras, can I feel what's going on tactily, but I can also see in real time on an X-ray exactly where I am with my instruments at all times. So
is it less? So it's less trauma.
Less trauma.
Less surgery, I guess, or less.
Yeah, less trauma, less surgery, and we're able to focus.
So the downtime's better now because of it.
It is, and it enables us to focus on the specific areas that are involved, and it's safer.
And you're the sinus guy. I mean, you love this procedure.
I love this procedure, and that's a big focus of my practice within our bigger ENT practice. But yeah, I like to do that stuff, and it makes people feel better.